Now starting. All attendees are in listen-only mode.
Well, good morning, good afternoon, everyone. Excited to have so many folks on the line today as our webinar series continues. The Devero webinar series, for those of you who have not been on before, we bring in experts who are passionate about home care and passionate about helping the industry. And we provide webinars on a variety of topics that are aimed at helping agencies succeed, whether you're in home care, home health, hospice, or any care at home service line. We're really excited to see you succeed, and we're pleased that you're taking the time to help or to join us and take in some of this information. What I wanted to do was a little bit of housekeeping before we begin, as folks are joining us. I'm going to go ahead and go to the next slide. We're going to talk about GoToWebinar for those of you who haven't used it before, or just so you can understand what we're doing here. First of all, I just wanted to let you guys know that this session is being recorded. So that's always the number one question. Some folks can't, register and can't join us, or they want to, or they enjoy the content so much that they want to share it with colleagues. We do record it, and we will be sending you an email with a link to it. And that'll either come end of day today or possibly tomorrow. But this will be an interactive session. At least at the end, we'll take some questions. There is a question pane at the bottom, and you can submit your questions. And we'll answer them toward the beginning of, or toward the end of the session. We also have a couple of poll questions. But the number one thing I wanted to talk about was the audio. If you're having audio problems, you're not hearing, click on that audio pane, or the audio plus sign, and you'll see a dial-in number. And typically, if you're having audio problems, it's because you're listening to the audio on your computer and maybe there's connectivity problems. Go ahead and use the dial-in number and you'll get a guaranteed signal there. The handouts to this session, I apologize, I see that they are not loaded. They will be loaded in about 5 minutes here, and we'll have them available there online if you want to refer to those later. Go ahead and go to the next slide, and we'll talk about some upcoming webinars as folks are joining us here. Just want to let you know that we do have some webinars scheduled throughout the remainder of the year. Coming up next month, we'll talk about HIPAA and home care and hospice agencies, and Roger Schindel will be joining us to talk about common violations, how to avoid them, how to rectify them, situations, and also anyone who joins that webinar will get a 1-hour certificate of attendance that Roger says will pass regulatory scrutiny. So be sure to join that, or have your HIPAA privacy officer join that. We're excited also in September to have a webinar about the 5-star ratings in home health, not good enough for the long haul. And we're excited to have an expert presenter here talking about the future of home care, what it's going to take to succeed in a value-based purchasing environment. In October, we have a hospice quality reporting data and trends. Our friends at SHP Data will be joining us for that. In October, we'll be recapping the final rule in home health and talk about the highly talked about home health grouper that's proposed for 2019. And then we're really excited today to announce that Melanie, our presenter today, Melanie Stover, will be back joining us in November, and for a follow-up webinar, and talking about bulletproofing your accounts, post-acute collaboratives, and secrets to delivering great value to your referral sources to keep your competitors at bay. So we're really excited to have such a great lineup, and we welcome you to join us for any or all of those. Pass them on to other folks in your organization. They're free. They're of the best caliber. We bring in the best presenters, and we'd be honored if you join us for more sessions in the coming months. Quick poll. Just wanted to know of everyone who is on the line today, before we begin, what service lines do you currently provide? If you wouldn't mind selecting your main line of service, not just it's not multiple choice, just your main line of service, your largest line of service. And we'll give this about 10 more seconds for you to complete this, just to see where we are. And I'm going to go ahead and close it. And let's see if I can share this for everybody. So we can see that we have a 85%, the largest service line is home health. And one more poll, if you don't mind, just for those of you who are on the line, we wanted to see who is currently a Devero customer, if you wouldn't mind checking the box. If you currently are a Devero customer, if you're not, that's great. We're super pleased to have everyone joining us on the line. And it looks like about a 50-50 mix, so we're excited to see a great diverse group of folks on the line today. So before we begin, we try to make these webinars informative and as informative as we can. We're not creating these webinars to be salesy, but I do want to mention the sponsors of the webinars. And of course, Devero is a NetSmart solution now, and we're excited to be part of the NetSmart family. Devero is the fastest growing solution for home health, hospice, and other care at home providers. We're the EMR of choice for some of the largest providers out there, as well as some of the regional players and local agencies as well. And joining the NetSmart family gives us the ability to build on what we've already done with the ease of use and adaptability of Devero. And our goal here as part of the NetSmart family is to build the most connected solution in home care. And we'll be making some announcements about that in the near future. The presentation today is Melanie Stover is on the line, who's going to start in just a moment. Her company is Home Care Sales, helping agencies achieve census growth and increase revenue through proven referral formulas for success. And they're a clinician-owned firm specializing in home health, hospice, in-home care sales and field marketing, education, training, and strategy. Melanie is very well known in the industry. I've seen her and heard about her training sessions with some of the larger providers out there. I see her at the conferences. And you really have to respect someone who's not only an MBA, but has a master's in info systems and is also an occupational therapist. I just think that's an awesome combo to have join us today. So with that, I'm going to go ahead and turn it over to Melanie. And Melanie, welcome.
Thanks, Rob, and thanks, Devero, for having us. And thank you for joining us. We appreciate that you have lots of choices with your time, and I want to honor that. And even though this webinar is free, your time is not. So I want to make sure that you walk away today with some tangible things that you can implement, that you can go out today, use with your sales team, and walk into your referral sources to position yourself as the expert in home care, home health, hospice, private duty, whatever your service line. Now, I recognize the majority of you are home health service line, and so we will tailor a lot of the conversation today towards home health. However, please know that you can use these same tactics and strategies whether or not you're hospice or private duty in home care. So let's get started. Oftentimes, for those of you who don't know me, I always think of when I go to NAC or when I go to any of the big conferences, is this going to be worthy of my time? And who is this presenter? And is she going to share with me something that hopefully will give me some ROI on this time that I'm spending with her? And my name is Melanie Stover. I've been in this industry for 20 plus years as an occupational therapist and have worked my way up through the ranks. I was a home health clinician, a sales rep, a manager, a leader, and today I help agencies across the country increase their census through repeatable sales processes to help them gain new patients and clients, growing revenue, but most importantly, impacting people's lives. I'm also the co-founder of the High Performance Sales Academy. Cheryl Peltekis and I founded this academy together, and it is a industry-specific comprehensive educational system. So when you look at our academy, it's about marrying the online technology of gaining folks skills that they need, and also a live event, a transformational event where they can practice those skills. So today what you're going to see when I talk about building a sales expert, I really talk about how can we be that trusted resource for our referral sources. And you're going to get a little peek into our academy here on some of the exercises that we do both at the academy and with our private coaching and mentoring clients so that you can take some of these pieces of the puzzle and put them to use into your agency. So let's talk about how you feel about the word sales. What does sales mean to you? And let's let that land for just a minute here. For those of you who have felt any type of negative emotion when I shared that word with you, I offer to you this rewire or reframing. To me, sales equals profound service. Sales is sacred. I know that when a family needs our help, they are not in a great place. The reason that they are seeking me is because something no longer is working. And so I honor them and their path. And this is why I believe sales equals profound service. Another thought or feeling that may be present for you right now is, and especially for my clinicians in the house, because I recognize those of us who have clinical backgrounds believe that we are here to serve and help and care. And sometimes they can feel like, oh my gosh, I have to go out in the field, and how does that feel to me? And I'm afraid of rejection. I don't like rejection, and therefore I do not like sales. So if you have any of your team that feels this way, I offer for you to do this exercise together with me. And I call it the why. Where is your personal compass? You as this salesperson for your organization have so much integrity that you wouldn't be with your organization, your agency, unless you felt it was the right decision. So why are you doing this? When I think about my sales reps and I take them through this exercise both at the academy and then also with some sales teams that I manage across the country, we talk about why. What's our why? Why are we going out there every day, 40 calls a week, knocking on doors, often getting rejected, often not seeing our social workers or case managers? Why are we doing this? And the easy answer for me early on was, I love seniors. And I do love seniors. But it goes deeper than that. Your personal why is going to get you through this feeling of, gosh, I don't like rejection or I don't like sales. When your mission becomes bigger than what you fear, you will become unstoppable. So why are you doing this? I'm doing this now. I realize it's because I believe there are seniors out there who are suffering and they're not getting the care that they deserve because they do not know, or our referral sources do not understand what we have to offer. And quite frankly, that breaks my heart. So why are you doing this? When you can get your sales reps to understand their why, They're going to be more passionate and have more of a reason, if you will, to go out there and help gain the clients or patients to become your clients or patients and impact those families' lives. The second question I always ask is, who do you want to serve? So this is more of a, some of you serve specific populations, for example. Maybe it's private duty, Medicaid private duty, maybe skilled nursing. Maybe it's a specific diagnosis. I have an agency that I work with right now whose family was impacted by Parkinson's. They have a big movement disorder specialty area. So who do you want to serve? And then finally, why does it matter? When you sit down with your team, or if it's you as the sales rep, figure out your why. When your mission becomes bigger than your fear of going out there or getting rejected, or you have to dig deep on a Friday at 4:30 to go out and make that one last call. When your mission is bigger than yourself, you will be unstoppable. And as sales experts, that's what we want to be. We just want to be unstoppable. We want to be in a position where people look at us as a trusted resource and allow us that opportunity to be unstoppable so that we can serve more. So the title of this slide, or the title of this webinar was, how do we make a sales expert? And we're going to do this countdown method. We talked about the 3 key reasons here. And we're going to start with reason number 3. It's about knowledge. So think of the best sales rep you know right now. Just think about them in your own mind. Imagine them. Doesn't have to be in home health. Doesn't have to be even in our industry. It could be your copier salesman. Doesn't matter. Think in your own way. Think in your own mind right now. Who is the best salesperson that you know? Write their name down. You got a little piece of scribble paper here? Just write their name down. Now start thinking about, what do you like about them? The thing that comes to mind most often to me, it's about knowledge. It's about being a resource. When I think about the best home health sales rep I know, she happens to be a nurse, and she happens to be such an amazing resource, because not only can she navigate the hospital, but she can navigate the doctor's offices. She can help people with community resources, and she's kind of the go-to lady. When somebody needs something, it doesn't always have to be home health, but it usually is. They go to her and say, this person needs home health and needs some other things. Can you help sort that out, right? Her knowledge is so vast that people automatically gravitate towards her, because not only is it knowledge, and later we're going to talk about it, Mindy gets things done. You ask her to do something and it is done, and you have complete trust that it's going to be done. So let's talk about knowledge as it relates to a sales expert in your industry, in your service line. So we have something called the fast track orientation that we have, and I work with my clients on, and it's about getting our sales reps up and running as soon as possible. You know, back in the day, we used to take our clinical educator and bring her out and say, hey, can you go over home health with our new sales rep? And gosh, I don't think that was the best use of time, because our poor clinical educator was working on some other things, and we pull her out, and the sales rep was kind of overwhelmed, and they didn't always know, but they needed to have this information. So what we do today, and you probably do this too, is help them gain it in a micro-learning environment where they can take chunks of it. You talk about adult learning in chunks. So knowledge, you know, Chapter 7 of the Benefits Policy Manual is a dry read. It's 99 pages of probably not the most exciting stuff you've ever read, but it does allow us the opportunity to become very knowledgeable about what can we do. What will they allow us to do? And how do we get paid? The second thing we talk about is specifically for your agency. So the knowledge around your agency. What does your agency provide? And do you provide any specialized care? The third one is tricky for owners and leaders if you're on the phone, because I get pushback from owners when I say, okay, let's define your ideal client or patient or referral source, because they will routinely tell me, I want everything. Just give it to me, Melanie. I just want some Medicare patients, please. Well, that's part of it. Sure, you have a payer source to consider, but what else? What do you guys do well? So we create this ideal client, and you talk about what is their age. It's probably over 65 for most of you. What is their insurance? It's probably Medicare for most of you, but I've been with some agencies who love some commercial payers. What diagnosis do they have? What services do you want to receive? Right now, I'm working with an agency that I'm coaching their sales reps, and guess what? Of course, we're on nursing slowdown. We got PT, but we don't have nurses. So, gosh, here we go. Our ideal client has just shifted. And so where we go for referrals, or where I direct them to go, is going to be shifted. And where do they, quote unquote, live? Are they in an AL, or are they home? Where are they going? And where do they come from? Who's going to refer them? And then finally, we have some fun with this, but we actually name them. And the reason we name them is so that we can quickly identify that I'm looking for a Nancy, or I'm looking for Ray, who happens to have, our COPD guy. So I would share with you that get really clear on who you're looking for, because the patient or client or referral source that you're looking for is going to help drive your sales reps to become experts in those areas, meaning that they're going to become experts in the AL environment, or the SNF environment, or the hospital environment. We all have reps who do a really great job and often niche themselves because they have figured out the system. They figured out how an AL works, for example. But that doesn't have to be their only, and some of us don't have the luxury of having multiple reps, so we don't have an AL expert, for example. So recognizing that you're looking at different referral sources who can benefit from different approaches will help you increase your knowledge. The second thing I talk about a lot at the Academy is become a student of the industry. I have a sales rep right now who spends a lot of time reading at nighttime and reading while she's sitting in chairs at the doctor's office in the waiting room, reading industry material, because, quite frankly, she doesn't come from our world. She's a sales rep from another industry, and she is learning healthcare. And so she's kind of building the bus on the road, and we're helping her by having her become a student of the industry. I will also share with you that just because you have a rep, or you yourself have been in the industry for 20 years, doesn't mean that you're a student of the industry. And I'll give you an example of that. What I will share with you is that what I will share with you is that when you become a student of the industry, you are going to be able to get deeper and have more meaningful conversations with your referral sources, so that you can be on top of industry changes. So become a student of the industry. And then finally, become a student of your referral sources and their industry and business. So what do I mean by that? I just had a great conversation with one of my coaching clients this morning, who's a sales rep, and she is working very closely with a SNF with rehab on a hospital readmission reduction kind of program, and that allows her to have these really juicy, meaty conversations with that referral source of the SNF with rehab and help them see her worth. So she is positioning herself as an expert in their mind or as a thought leader because she's bringing ideas to the table to help them protect revenue and also help them gain revenue. So not only is she working on behalf of the home health, right, to get more patients and help those patients transition home appropriately, but she's being looked at by the referral sources as an asset. The second thing I want to bring your attention to is, when was the last time you interviewed your referral sources? Like, really interviewed them? What do they want? Sure, some of you have been in the industry a long time, 5 years, 10 years. When have you asked them some of these probing questions? What do they want? What payment changes are they facing? What are some of the goals that they're looking at to achieve? Our sales reps are often so good at relationship development, we sometimes forget to continue deepening that knowledge of what do they want and what are they facing. All right, so let's talk about being an advocate, because at the end of the day, we are patient advocates. Home care educators first and patient advocates second, I feel like oftentimes. On the road to becoming a sales expert. The second key element on our countdown is skill development. So with practice comes proficiency. And my question to you is, when was the last time you practiced? When did you say your 2-minute invitation out loud? When did you role play last? And when did you write out a script or phrases? It's not good enough to have knowledge. You must also possess the skills. For all my nurses out there, think about this. Think about the first time you did an IV. How did that go? But with practice, you became better. So let's try some micro-learning here. Take out a piece of paper and write out 3 open-ended questions you like to ask to uncover opportunity. I'm going to give you 30 seconds right now, because I know that once you leave here, you're going to be busy and you are going to say, that was a nice presentation, but I got to go and I got to go call on some referral sources. So right now, take 30 seconds. What are your 3 favorite questions? All right, so I'm going to share with you mine. Here are my 3 favorite questions. Share with me your biggest challenge as it relates to home health, or your top challenges as it relates to home health. Number 2, what are your goals for this department? This is an awesome one to ask at the end of the year or at a quarter or even at the beginning of the year. This one I definitely have the teams that I manage long-term ask every year to our referral sources. What are your goals for this year? And number 3, what are some of the concerns around readmissions? What are some of your concerns around readmissions? What are they doing about it? You know, finally, after 2 years, or maybe more, I guess since 2012, of talking about readmissions and how can we help, all of a sudden folks are coming out of the woodwork. And because the reps that I work with have been talking about it for the last 3 years, now all of a sudden they're thought of as thought leaders, and bam, they're in the middle of it. They are getting these wonderful opportunities in post-acute care collaboratives to have meaningful discussions with people that they could never even get in front of in the past. So ask these really great open-ended questions that are going to open up our eyes to opportunities. So let's try this again. Here's another skill development piece that we do in the academy, which is, let's talk about, and we do more than 3, but in this case, since we're on limited time here, what are the top 3 ways to ask for a referral in a meaningful way? We call these home care trigger questions. Home care sales trigger questions. And what does that mean? A trigger question to me is, I want a referral source to think of a patient that is currently on service that could benefit from my service line. So whatever I'm repping, I want to ask a question in such a way that they think about those patients that they currently have on service, and if they don't know how we would help them, help those patients, it sets them up in such a way that they look at you and say, well, how would you do that? This isn't the whole, hey, you got a patient for me today, or who can I help? These are more in-depth questions that are going to get you results. The other questions are okay, but oftentimes they get us knee-jerk no's. I call them knee-jerk no's. That basically means like, hey, you got a referral for me? And the referral source goes, no, not today. I can't think of anyone. It's because it's not inquisitive enough that allows them to think of their patients. So you may need some examples of this to make it more clear. Let me share with you my top 3 ways to ask for a patient. And since I was just working with a rep on a hospital readmission reduction program for her SNF with rehab and hospital, here's the 3 we came up with. Now this one's a physician one, oriented one for at her clinic, which is part of the system. Which one of your patients have required treatment for rapid weight gain because they have a hard time controlling their diet? Now this was for a CHF skills or CHF target. So which one of your CHF patients have required required treatment for rapid weight gain because they have a hard time controlling their diet? That spoke to our nursing component and helping them manage their disease process at home. Number 2, which CHF patients came back to the ER where they received oxygen for comfort and diuretics and then were discharged to return home? She asked that for the ER diversion program, looking to help those patients stay out of the hospital. And then number 3, once a heart failure patient leaves your facility, they will be in that 30-day post-acute care discharge window. How do you help them reduce the number of readmissions once these patients leave the facility? And that was just simply to stir conversation about what they were doing and how we might be able to, or how her agency might be able to meet them or marry them where they're at. So now we become a resource. We got knowledge, we got skills, and now we want to be a resource. We talked about Mindy earlier and how she was a resource where she simply got things done. She was a nurse who kind of had it all together. She had the clinical background, she had the sales skills, and she had the community resource, and it became a whole package. She was the expert. And she became a resource. And now we are down to number 1. The key element number 1 is implementation. A thought without action is simply an irrelevant thought. So we can have all these great ideas, but if we can't implement them, then it's like we didn't do them at all. So let's talk about our roadmap to referrals. Our desire in roadmapping out a roadmap to referrals is that you would have a map each week to help you get the number of patients that you deserve and, quite frankly, that they deserve. I think all of us would agree that the number of patients receiving home health, hospice, and private duty in-home care is smaller than the actual patients who could benefit from our services. It's about expanding the pie. I still have reps that I work with on a weekly basis who routinely tell me that they are working with referral sources who didn't know a specific component of what we do. Oh, they didn't know we could do IVs in the home. Oh, they didn't know that we could offer PT in the home. Oh my goodness. Even some of the things that we think are super obvious, they either have forgotten or maybe they just didn't know in the first place. So your responsibility, your mission as a sales rep is to leave no patient behind. It's to expand the definition of your referral sources so that it includes everything that we do. And we can maximize the impact that we make out in our communities and ultimately in our world. In our roadmap to referrals, at the Academy, we talk about the unique selling points. So what are your differentiators? And I think this is where the rubber meets the road for most of our reps. Our referral sources commoditize us. They all say we have OT, PT, speech, and nursing, or they all say we have bathing, dressing, grooming, meal prep, but they aren't grasping the individuals and the expertise that lies in your specific agency. And oftentimes that revolves around the agency themselves. It could be your owner or your leadership. It could often is the representative themselves providing superior customer service. And what about your team? What about your clinical team? What are they doing? Or the intake team? There are so many opportunities for you to find differentiators in your agency. You as a sales rep and also as a leader of the sales rep have to figure out how to rise above and stand out from all the noisy competitors. That's where we come out with unique selling points. So think about what are your differentiators and how are you going to share your gifts with your referral sources in a meaningful way so that they go, yeah, I want to choose you. You're my home health agency. So as we move through the roadmap to referrals, unique selling points is one of those key differentiators where you can arm your sales rep with those differentiators and gifts so that they can then go out into the field and make valuable sales calls that make a difference in the lives of the referral sources. So when we talk about a roadmap, we know that with structure comes freedom. And oftentimes as a sales rep, and especially even myself, as a younger sales reps, I didn't quite understand this. I didn't really get with structure comes freedom. I kind of felt like with structure comes what? There won't be any room for me to be myself or to be artistic or creative. But what we're saying here and what the Academy really brings to the surface is that with structure creates freedom. What that means is that when we create your roadmap and you identify your differentiators, and then we calendar them. That means that every week you're going to have something to say that's valuable. So you never make a no value sales call again. It allows you the opportunity to calendar each week a specific topic that's not only going to highlight what you do, but it's going to come with ease because it's what your agency does well too. So you're not going to have this big struggle about what am I going to say this week? Where am I going to go? It's going to be more like, all right, I got this. I know that we do Parkinson's well. This week is a Parkinson's topic, sales message of the week, along with a trigger question that's going to give me discussion points when I'm in the referral source. So we call this roadmap to referrals. It's what we develop so that the sales rep has, along with the sales rep in collaboration with them at the Academy, they'll help do their first month and outline it so that they can see it in real action. You too can do it at home by creating a calendar with the sales message of the week, and it allows your your sales reps to bring to your referral sources meaty conversations, and it also gives it to them in adult learning bite-sized chunks. Those kind of sound bites so that they can remember them. All right, so let's talk about the next steps. Here we are, 40 past the hour. I want to give us a little time to ask questions if you have any. in this presentation, we talked about micro learning. That was that try it now section. Remember when I asked for the 3 ways to ask a trigger question, for example? I would ask you to share that with your sales reps. Together at staff meeting or independently, have them come up with some of their own trigger questions that they can use out in the field. I'd also ask that when you look at this presentation and you say to yourself, gosh, you know, I need more help in my knowledge area, or I need more help in my skill area. We wouldn't let our nurses and therapists go out and not have a care protocol to follow, a treatment protocol or a care pathway to follow. Why would we not have that for our sales reps too? So help them, and if you're the sales rep out there, identify do a self-evaluation. Where are some additional needs or opportunities, and then seek them out to fill in that educational gap so that you can become super proficient. With proficiency comes confidence. And confidence propels you into that sales expert area. It also helps propel you through doors that are shut and gives you the passion in order to continue your mission of serving more patients and gaining more referrals. Every time I think to myself, gosh, this has been a tough day, or I can't get through at the hospital, the things I reflect back upon is my unstoppable mission. Why do I do what I do? My job is, and my mission is to serve more lives. And so I'm offering an invitation to you. This is what we do with some of our private clients. To add value to this program, I invite you to email me to set up a time to discuss your sales alignment. I have 5 questions that I ask my clients to help them identify areas that they can gain leverage. It takes about 20 minutes, and I'd like to extend this offer to you for free. If this is something that you would like to do, you are welcome to email me here at Melanie@HomeCareSales, and the first 57 people who email me will extend that offer to you for free. And finally, I'd like to also extend an invitation for you to join us at the High Performance Sales Academy live event in Las Vegas. It's October 4th through the 6th, and you can sign up today at Home Care Sales and click on the High Performance Sales Academy and learn all about it. The live event is just one piece of the puzzle. It's a whole comprehensive system that includes group coaching. It also includes online video training in micro-learning environments like you just saw here, where we ask you to do small incremental skill-building tasks that allow you to build your confidence. So we're super excited about that, and to join us live in Las Vegas where the transformation happens. It's an immersion-style workshop. In addition, finally, you are the sales expert. Step into who you were meant to be. You are here for a reason, and I believe that reason is to help as many people as you can get the care that they deserve. So take the next step. Join me in profound service to our seniors. Thank you for spending time with me today, and thanks Rob and DeVero for being such great hosts.
Well, thank you.
Rob, do we have questions?
Yeah, Melanie, thank you so much. Great. So, the offer that you made the first 57 people to email, and the emails, the emails on the current slide too. So that's the same email. Yep. To get that that offer. That's pretty cool. We do have a couple of questions, and one of them, well, one person asked, it was about 15 minutes ago, to repeat something that you had said, but I just wanted to let everyone know that we are recording this session, and it will be available to you either later today or first thing in the morning. I did want to make a note too that the handout is now posted in the slides are now posted in the handout section, and you can find those available for download on the GoToWebinar pane on the lower right section. So yeah, Melanie can stick around for a few minutes here with us and answer questions. And I'm not sure if you can see the questions, Melanie, on your pane or not. But I'm not. Michelle Morales asks, how do you suggest approaching referral sources on CJR patients with being able to do more than 6 therapy visits?
Yeah, that's a great question. So just so you know, Rob, I have a couple clients on the line here who also indicated that we have lost sound.
Oh. So
while you and I can hear us, I got a couple text messages here that says that our audience can't hear us.
We might have lost a couple dropouts, but can someone just comment there in the chat pane? Can you hear us? Okay. Well, I'm getting feedback that people can hear us.
Okay. Awesome. All right. Well, thanks for that. Okay. So the question is about CJRs, right? Oh, Lord have mercy. They want to give us 4 visits. Is probably the most common complaint that I hear. I'm working with a couple agencies now who the sales reps do struggle. And we have had conversations with the orthopods. My husband's in orthopedics. I get it. I understand the pressure that they're under. My first recommendation to you is basically go share your plea, right? That this is kind of how we get paid, and this is what we're looking for, and can you help us out, and is it clinically appropriate to have them 6+ visits? And as a therapist, I would say yes, right? So I would definitely work with your orthopod, number one. I have been in large systems where the orthopods have told me they don't care, that they are going to give us 4 visits and they don't want to hear about it. So we can either play ball or we can't. And so that then becomes a discussion for you and your leadership of what do you want to do about that? Is that something that you want to participate in, hoping that in the future when they do go to True Bundle and they start paying you per visit, is that something that you are going to benefit from? And that becomes another very frank, honest discussion with your leadership, and often with the orthopedic group or whomever is responsible for that bundle program, to have those conversations. Are you willing to basically lose money in some cases for a short period of time to prove a model in order to move through that model? And I can't answer that for you, but I can share with you that it is discussions that we have all had, and that it is a challenge, and we recognize it as a challenge. And so I'm sorry, that's probably not the most awesome answer you ever wanted to hear, but it is the truthful answer.
Mm-hmm. Okay, any other last minute questions before we wrap it up here? I'm sure that folks are busy emailing Melanie. That's pretty generous to have offer 57, so that's great. We'd encourage you to do that. Take advantage of Melanie's offer. That's pretty cool. While we're waiting for any more questions to come in, I just did want to remind you again that we do have Melanie back for another webinar in November. And we do have other webinars coming up. I mentioned in September, Roger Schindel is going to talk about hospice and HIPAA, hospice and home care and HIPAA, and then we have Michael McGowan here to join us with a webinar about 5-star ratings and how it's not enough for the long haul. So I wanted to just touch on those, and I'll go ahead and put the link for those in the chat window if you like. And at this point, looks like there's no more questions. Again, the recording will be going out to everybody very soon. And we thank you for joining us. We appreciate your time. Melanie, thank you so much. That was a great presentation and great information. And can hear your passion and your commitment to not only the the agencies out there, but the patients that they serve, and we certainly appreciate that. So thanks again for joining us, everyone, today, and that's going to conclude our webinar.
Thanks, guys. Have a great day, and I look forward to seeing you in Vegas.
Bye-bye.
Bye-bye.